Hi, I'm Lois Mkize, and you're watching Joburg Today.
Johannesburg and Cape Town-based scientists recently confirmed Africa's first reported case of a child in HIV remission. The 9-year-old is already more than 8 years in remission and was part of the Children with HIV Antiretroviral Therapy or SURE study. Almost 400 HIV-infected babies at the Chris Hani Baragwanath Hospital and the Tygerberg Children's Hospital in Cape Town took part in this research.
Reported cases of HIV-infected children achieving remission after stopping early ARV treatment are extremely rare. There are only 3 known patients globally, and this includes the South African child treated at Baragwanath.
Since the child stopped antiretrovirals at a year of age, the viral load, that's the amount of virus in a ml of blood, was undetectable using the standard assays.
The first thing we did was, using much more sensitive methods, try to detect virus in the host cell DNA. And there we saw traces of virus in a very few cells, but it was detectable. Again, confirming absolutely the child is infected.
We call it latent, and that's why we're saying it's a remission. We're hoping it's extremely long-lasting, if not permanent, but we don't know that for sure, and we will definitely need to follow this child.
ARVs for children were but a dream, and children's ARV treatment guidelines were seriously lacking when Professor Cotton of Stellenbosch University's Family Infectious Disease Clinical Research Unit and Dr. A.V. Violari of WITS's Perinatal HIV Research Unit planned the SURE study. Their 6-year randomized trial was the first to influence ARV treatment methods.
We compared the standard of care, which was again waiting and watching, to a strategy of starting antiretrovirals immediately in infants as soon as HIV was diagnosed, and then treating until either the first or second birthday, and then stopping, and then watching them carefully to see whether they could have an extended period of time off antiretrovirals. The idea would be they would get over the vulnerabilities of infancy, and then if they could stay off antiretrovirals, their management would in fact be much easier. There wouldn't be medication fatigue. There would be, we'd have less of a chance of getting resistance to these medicines.
Professor Timmerson's multidisciplinary research group looks at immunology, virology, and host genetics. They are still trying to find reasons for this unique case of HIV remission. It's already clear that the child differs from infected adults with the natural ability to control the virus to undetectable levels.
A key characteristic of elite controllers is that they have certain genetic features. This child does not have those, and they have these very broad CD8 T cell responses. This child doesn't have a response like that. The important thing also about the tests that we use is it gives you a quantity, it gives you an amount that's there, and we've determined that at 9.5 years of age there were 5 copies in about 1 million of these mononuclear cells. Interestingly, we also went back to 1 year of age, so that was the time point at which treatment was stopped, and the same quantity of that HIV DNA is in the cells at that time point. So we've tried to reactivate the cells. That's a normal procedure people would do to try and see if there's active replication of the virus. And to date, we have not been successful in identifying any virus that has the ability to replicate in other cells. We've also gone back and looked again at 1 year of age, done the same thing. We can't detect virus at that time point. It means one of 2 things. Either our methods are not sensitive enough to detect very, very small amounts that might be there, but perhaps the immune response of the child is actually keeping that under control. Alternatively, there might be particles produced that don't have the ability to reinfect new cells, but somehow that latent traces of virus are remaining in the child.
Despite evidence of the benefits of early limited ARV treatment for infants mounting, people shouldn't stop treatment outright.
We know that the standard HIV tests can be negative, and that is extremely important for people to know. We know they are not sensitive enough. We don't know which 10% would respond to early treatment and then stopping treatment. In our case, we have one child out of approximately 260, but it is extremely important that they do not stop antiretrovirals in an unsupervised situation. So that's where we are now. It's a glimmer of hope, but there's a long way to go.
The NICD team's work now, amongst others, focuses on understanding the child's immune response and this specific HIV virus's genetic makeup. Marise de Klerk, Joburg Today.